Treatment of the neck, traditionally compared to a regenerative approach, like everywhere else in the body, is very different. Where in the 1980s, when a lot of the interventional pain procedures were being created, there was a concept called the pain generator that was, kind of like playing tag with something and trying to find where this was. It was a very noble effort, actually, because it was the medical system trying to understand where surgery would most effectively be done on somebody. So the way that this branch of medicine evolved was from a surgical mindset and understanding where pain was being created to do surgery. That was a step up from what had been done previously, and it was, again, a noble effort. The regenerative or restorative, rejuvenative treatment of a neck is very, very different. Think of it this way. Surgery is kind of like having a whole line of dominoes, and the very last domino that falls is the thing that's worked on by surgery. All of the reasons why that structure might have been painful or needs surgery is ignored for the most part. And what I've found over doing this for the last 11 years is looking backwards, unwinding all of the root structural, neuromuscular alignment, strength, stability reasons why things are degenerating is what develops a regenerative paradigm for an area of the body. There are basic things that have been learned, like if one facet joint, those are the joints, there's one on each side of each level of the spine, very small joints, maybe the size of your finger, that allow for some motion and some movement, but some stability as well between vertebral segments. If these facet joints, one is painful on one side, to only do a regenerative injection on that side is treating a symptom, pain. That doesn't mean that that's where the instability component of the problem is. So what I found over time is things need to be treated generally on both sides for every level of problem. And which agent is used is very critical also. In my series that I created with Dr. Wogan with digital motion x-ray, if there's instability in the upper two segments of the spine, using just platelet-rich plasma, even very carefully and very broadly done injections, treating 7 different tissues all at once, is only sufficient about 50% of the time to have a person do only one procedure to heal them. If I add a cellular component from either adipose or bone marrow, I can get that up to 80 to 90% of the time that a patient only needs one set of procedures. So that's first dividing point. Second dividing point is if there are a lot of neurologic symptomatology with a neck, either radiating nerve pain or pain that can actually come from peripheral nerves. These are things like greater occipital and lesser occipital nerves around the head, and there's changes in balance, changes in hearing, changes in vision, changes in mood. This is a constellation of symptoms called Barré-Liao syndrome. If a lot of those symptoms exist, then there's significant superiority of using adipose cellular concentrates over bone marrow. And combining that with a derivation of platelet-rich plasma, that's uncommon. It's a released growth factor formulation of platelet-rich plasma. That's the best formulation for that problem. Just doing basic prolotherapy, which is generally dextrose, or even platelet-rich plasma, generally is not sufficient for the neck for long-term results, even combined with physiologic physical therapy, chiropractic care with those treatments. So I've, again, done this for a very long period of time and been able to create protocols and paradigms that meets a person at the level of usually being able to do just one procedure on them. to heal what might have been 20 or 30 years of dysfunction and deterioration.